Bill, are we set? Good afternoon. Good afternoon, everyone. I'm Oneida County Executive Anthony Picente. I welcome you to our COVID-19 briefing for today, January 9th, 2020. Our statistics, our numbers for today. Well, first of all, excuse me, I'm joined by, as per usual, by Phyllis Ellis, Director of Public Health for Oneida County, our interpreter, Vicki, behind me. A little different format for us today, and we appreciate our media partners joining us, and for all those on the line as we go through this this briefing today. To go to the numbers, update on where we are today. Another really high day in Oneida County. 264 positive cases reported on this day, which bring our overall lab reported cases to 6,842. We do have to report two more deaths as a result of COVID-19 on today's numbers, bringing that total to 164. Our deepest sympathies go to all those, all of the families and friends of the loved ones who passed, and all who have passed throughout this crisis. The total active positive cases is at 2,829. The number of patients hospitalized, or Oneida County residents that are hospitalized, stands at an all-time high of 119 today, with 85 at Mohawk Valley Health Systems, 20 at Rome Hospital, Rome Memorial Hospital, and 14 of our residents who are out of county in other hospitals, bringing that total to 119. The number of acute care positive patients that are in the intensive care units stands at 15, with 11 at Mohawk Valley Health Systems, 1 at Rome Hospital, and 3 outside of the county. Again, 15 who are in the ICU setting. The infection rate is at also a high of 8.2% in Oneida County, about 7.7% for the entire region, which is again extremely high. So those numbers we continue to track and maintain with our partners on state health. The governor spoke today. Obviously, he went through a variety of issues and numbers, spoke about the vaccine and the potential rollout of that, as we have talked about it prior here. That much of the rollout will first off include healthcare workers and high-risk individuals. And but I think the good news that was with all of that beginning hopefully in the next couple weeks and throughout the first of the year, that in February, after we get through the stages of healthcare and high-risk individuals, nursing homes, etc., that the general population could see the vaccine as early as distribution as early as February. We will continue to keep everyone posted on how that will work in Oneida County and how soon the vaccine becomes available for us for distribution. Just prior to coming out here today, I was also on another media Zoom call with my fellow county executives from across New York State. There are 18 of us that form the County Executives Association of the state of New York, and we had a press conference in which we reiterated our need, and I know the governor did so as well as our need and our message to our federal leaders that the federal stimulus for state and county governments was essential, that they are negotiating as we speak a package in Washington, D.C. to put forth stimulus aid to states, and we certainly hope local government. We have reiterated that with our legislative leaders across the board. These are county executives from across the state. This is not a partisan issue. There are Democrats and Republicans who join together and understand that the need for aid to our governments that have been burdened during this COVID crisis by loss of revenues and great expenses as a result of what we are dealing with. I would like to thank Senator Schumer, who has been a leader in the state, for his work and his support of local governments. I'd also like to thank our congressional delegation, Congressman Brindisi, who has been also very supportive, Congressman Katko, Congressman Stefanik, Congressman Delgado, Congressman Reed, who have all been joining together in a bipartisan fashion to push for aid to local governments, in particular county governments, because of our work in this pandemic. So we are hopeful that, and as I sit here as a Republican, I encourage Senator McConnell and the colleagues on that side of the aisle to look at what local governments have been doing, understand the role that we play, understand that all that has been happening in the pandemic in terms of contact tracing and all of the aspects of the various restrictions and directives have come from county health departments and county government emergency services. So we do need the assistance. I'll make that plug one more time. We need aid on the local level. We need aid on the state level, obviously, but we need to make sure that it's balanced and fair and that we are entitled to the assistance that is not, we are in obviously an unprecedented time here in terms of this pandemic. This is not, as I continue to say, a partisan issue. This is impacting all of our residents throughout this United States, and they're all the same constituencies. So this is not unusual at a time of natural disaster. The federal government comes to the aid of local governments. This is a federal disaster. We need them to come to the aid of local governments, so I encourage them again, and we will continue to stress with them and through our NISAC agency, the Association of Counties, and the National Association of County Organizations and Governments to really see that this federal impact aid gets moved forward. So I want to reiterate that today. Obviously, our numbers continue to stagger and continue to alarm with the great amount that we have also seen today. I mentioned yesterday that over the last 2 weeks, 37% of those cases, of all of our cases, came in the last 2 weeks. That number is growing, as you could see by today's number of 264. Clearly, over the last 2-week period, we are nearing a 3,000 mark of cases just in less than a 3-week period, really over about a 16 or 17 day period. I mean, that really needs to be brought down. So I'd like to think by now everyone knows what they should and shouldn't do. I know we've been aggressive about enforcement. Today we will, after this event, post the list of violators on our website for areas that have been cited during this pandemic. We hope that this will help everyone become more diligent, recognize the severity of this, because that these numbers continue to rise, and it goes back to what I continually say about our shutting down our community ourselves without any direct enforcement from the state or from the county in that regard. We cannot afford to let that happen. I know in the governor's words and ours, we share that we know that shutting this down has significant serious effects, from the economic aspect, but also it will not help us bring the numbers down. What needs to bring the numbers down is compliance. Many people are following the rules. Many are doing the right thing day in and day out. There are many who really don't want to believe that the virus can reach them. Some of them are getting fooled as they've gone forward. And there are some that just flat out refuse. I mean, that's a small number, but those small numbers are causing large numbers. And it's important for all of our residents to really come together and recognize that over the next few weeks as we enter into the Christmas holiday, that those get-togethers are again in jeopardy and most likely not going to be able to occur. And when they do occur, if they do occur, it will cause greater stress on an already overburdened system and really cause more illness across the board. We get numerous calls and emails and issues that come in each day, whether we do a briefing or not, about what's happening. Again, when we refer to the Thanksgiving holiday, we heard from many people who said that they were having people in their home and that we couldn't tell them. We didn't have the right to tell them how many people they have in their home. They're absolutely right, and we agree with that. Our point isn't that we want to tell you how many people they have in your home. We're just asking you to think about whether you should have that many people in your home at that time and what those consequences can lead to. I know that in the national news as well, the Thanksgiving surge is showing great numbers across the board, and that's clearly what we're seeing here. We do know that. So again, I understand the sentiment. Don't ask yourself again whether you have the right to do it or whether or not someone has the right to tell you. Think about whether you should do it, and think about the safety and then the welfare of your immediate family, the people you invite, the extended family and friends that become affected by it. And also just another point to make today in terms of this. So a lot of what we talk about on a daily basis, and whether it's about violations and whether it's about various areas of non-compliance or the like, I know that people look to us for being what they consider punitive at times, or even harsh in terms of our comments, or my comments in particular. Being an elected official, we are used to getting criticized on a variety of decisions that get made over the course of time, and being here as I have been, I'm well aware of that. The other day, in my briefings, I made some comments really about overall compliance. I talked about school safety, and in particular, it seemed that I had offended some of the school administrators regarding those comments. My comments were not meant to offend. My comments were meant to educate and to help the public understand. In fact, the very nature of it was talking about the safety of schools and how schools themselves have done an excellent job in keeping people safe, keeping their students safe. It was not about their decision-making process or about closures. Obviously, closures occur because there are outbreaks. My point in saying what I did was that schools are not the cause for the surge. Young people are not the cause for the surge. Students in those lower grades are not the cause. It's adults, and it's gatherings, and it's things that we have to control the best we can. So while I still stand by the fact that I believe K through 8 should be in session, while I also stand by my comments about extracurricular activities, that I do believe that a school should not be doing those right now, especially if they're not in instruction. At the same time, I met no disrespect in the context, but also want to point out that we all have to do what's necessary. And as Phyllis and I have sat and stood in front of you day by day since the beginning of March, and in Phyllis's role as director, we are charged with the public health and safety of this community. And people want us to do public health and safety until we do it. And then there's always a question or an issue of how we do it. All of our actions, all of our statements are designed with one thing in mind: to lower this number, to keep our community safe, to keep people out of the hospitals, to keep people from getting this vile virus that has plagued the entire world. Obviously, we're all in that same boat across the United States, and in particular across New York State that we work together with. So, we will work together. We will continue to enforce where we have to enforce. We will continue to take the appropriate action that we see as a county health department, as a county Office of Emergency Services, and through my office to ensure the health and safety of our residents at whatever means we use and we continue to refer to the CDC guidelines that everybody hears about each day on television, the news reports, social media, and the like. We work with our partners at the State Health Department, certainly through our expertise on the local level to do it. Our decisions are made with that criteria from the greatest experts that this country has and the agencies that are charged with doing this. It is not just that we pick things out of the sky to decide what to do today. It's about making sure and following various guidelines. Nothing we have done has been out of the ordinary. Nothing we have done has been, singling out one particular group of people or another. It's about all of us. It's about every industry, every business, every sector, every person to do the very best they can, and to work and to adhere to what we keep saying. These numbers keep rising. We need to reduce them, and we need to stop coming out here and reporting deaths and reporting the high number of positives. And hopefully we can get to a better place soon with the vaccine and with some more adherence to these guidelines. So before we open up for questions today, I have one piece of news to share with all of you, which really is very bittersweet in terms of what we have been dealing with and the work that has been done here. Phyllis Ellis came to my administration about just over 7 years ago. Phyllis had an outstanding career in the hospital, Mohawk Valley Health Systems and St. Elizabeth Hospital over the years, oversaw the trauma center for a number of years in the emergency department at St. E's. I was fortunate that upon her leaving that she wanted to embark upon the position of public health director. I joked that I begged her to take it at that time. Phyllis is first and foremost for me a tremendous friend, a great asset. There has not been anyone that I would not want by my side during this other than Phyllis. When I ran for re-election last year, obviously I talked to many of my key people here. We made some changes, and one of the questions I asked Phyllis, because when Phyllis first came, she promised me at least 4 or 5 years, and it turned into 7. Her plan was to retire this year. I'm sorry to say, but I'm happy to say, because it's deserved, she is sticking to that plan. We are really going to miss Phyllis's leadership, Phyllis's expertise. She wanted us to wait until the latest possible time to announce her retirement from county government. I really, it's very hard for me as the great friend that she is, but more importantly, the great professional that she is. From all of the things that we've dealt with over the past 7 years, but certainly over the past 9 months, her steadfast calmness in this office, her direction, her expertise, but also her leadership, really, and what we have accomplished. There's no way of even putting it together without Phyllis at the helm. So I'm announcing that today. It's again, as I said, very bittersweet, but it is well deserved. She has a wonderful family, and children and grandchildren she wants to spend time with, and no one can fault that. And the past several months have been stressful for all of us, but it's sticking with a plan that she had in mind. It's not. I've done everything I could to try to keep her around, but I understand. I support it. I respect it, and Phyllis Ellis is a great public servant, but probably one of my dearest friends, and I will miss you. And I'm going to hand the mic over to you because I can't speak anymore. So.
Well, thank you for that. Now you're going to make me speak during that. Are these okay? First of all, I'm very grateful to the County Executive, Anthony Picente, for the opportunity to lead Oneida County Health Department since 2013, August. It was my goal to assist the department for a short time, as we said, during the transition of the previous health director. Under the county's executive's leadership and our dedicated staff at Oneida County Public Health, many wonderful programs are in place to promote and protect the health of Oneida County. We're deeply involved in COVID response this past year, but I would not want to minimize the great work that our dedicated public health team has done throughout the years. County Executive has supported every program, whether mandatory or not, to advance the public health mission in our county. The Oneida County Opiate Task Force is truly an example of community involvement, partner agency involvement, and county government. There have been many to highlight, but creating healthy schools and community programs, cancer prevention and action, lead poisoning prevention, preparedness and response to floods, storms, additional communicable diseases like Zika and Ebola, and all the various communicable disease work that is done by our clinical team are to be noted. And in addition, numerous environmental programs to assure safety in food, water, homes are key elements of public health. Oneida County provides early intervention and preschool education programs for qualified children in our county, and is an enormous program to assist our families. Of course, our immunization and TB programs in all of our clinical areas that our community relies on are essential. The county executive has also supported the health department in developing the first and very robust employee wellness program, which has helped so many employees reach their health care goals, and he has won various awards, which is a testament to our hard-working staff. I'm leaving my role knowing there is a great team to carry on all of the important ongoing public health strategies that are in place, and wish all to remain well during this time. As I highlighted, there have been many good things done throughout this community with the assistance of Oneida County, to include working with our hospitals, pre-hospital, frontline workers, schools, all of the community agencies that have had to work through many tough times this year. This is one of the greatest public health issues in my lifetime and in my career, and in most people's lifetime as well. So in over my 40 years in healthcare and in my public health experience, I do understand that public health mitigation works. If this is my last opportunity to address this issue, I implore everyone to please continue to follow all of the public health guidelines that we have been talking about throughout this year. We know they work. Masks, distancing, hygiene, avoiding gatherings, quarantining away from anyone that you know that have been exposed, and when available, of course, the vaccine. These are the only things we have that we know are beneficial and they work. So please continue to be the best community who cares about their family, friends, and community members. Excuse me. Thank you for the county executive and the county legislative leadership, and to all the staff for the opportunity in my healthcare career. And be well. And thank you very much.
This would normally be a point of a hug, but we can't do that given social distances, and that's never enough in these circumstances. So to clearly I can't say anymore. As I said, I don't know another more dedicated person, but as someone who literally takes this job to heart each day. There's been a lot of long days over the last 9 months, and I want to thank her again. I also want to thank her family for sharing her with us, for letting us have her really over the last not just several months, but this last 7 years, and really the last 9 months that she's been working around the clock with us. So with all of that, there'll be more, I'm sure, to say in the days ahead, but. With that, Phil will go into questions and go from there.
Okay, joining us first is Rocco LaDuca from Talk of the Town. Go ahead, Rocco.
Hi, Phil. Can you hear me all right? Am I coming through?
Yes, we can.
Okay. Well, let me be the first member of the media to congratulate Phyllis on your retirement.
Thank you.
I guess I could have, everyone could have seen that coming, but probably I think that was the last thing we were thinking about. But thank you for everything you've done, for answering our questions, for being in the midst of all this, and everything that Tony said and you yourself said. I think all of us in the media appreciate everything you've done on our part as well to help us inform the public.
Thank you.
That's all I have.
Thank you, Rocco.
No, not really.
Okay. Go ahead, Rick.
My first question, you just bear with me, sleeping inside here. My first question is, I didn't hear when you said the positive infection rate. Can you just repeat that?
8.2.
For Oneida County?
8.2.
8.2.
8.2.
Thank you. And what was the region?
7.7, I believe. That is taking, Rocco, the 7-day rolling average, if you will. I mean,
Okay.
that's what that's based
Yep.
on, under the criteria, the state criteria and what we've been reporting.
Okay, and when you mentioned, we've been talking about this database of the violations of businesses, residents, and organizations, and that you're going to be making that public fairly soon. I just want to be clear, I guess, because I think you touched upon it, but what exactly is the objective or the goal of identifying each of these individuals or businesses? Is it a matter of, I guess, embarrassing them or shaming them in any way, or encouraging people not to go to those premises or deal with those individuals?
No, that's not it at all. Well, the latter is not it at all. It's not a matter of embarrassment.
Yep.
It's not a matter of dissuading people to go to those businesses. It's a matter of, just like other aspects of public health, we do. Phyllis went through the list, really, of what the health department does, and there's so many other aspects of it. But, there are executive orders in place. They do get violated, and when they do and those violations are equal in any other public health law or any law, for that matter, sent down by the governor or enacted by this government. So, much like other things get reported, we have been asked in the past about, are we enforcing? The governor has in fact scolded us at times by saying, local governments, you should be doing your job, you should be enforcing. We have been enforcing. We try, and when you look at those, you'll see that some are have occurred multiple times before we actually enacted a fine or an actual violation. So it's not designed with that, in fact. It's designed to show that we are doing our job in terms of enforcing, where we get complaints, where we get actual acknowledgments from various residents or other agencies that are informing us of that, much like we do in the case of other violations throughout this county, whether it's on the traffic side of things, the inspection side of things, or the like. It's not designed, but it's also designed to let people know that this is a serious issue, and serious issues have serious consequences with them. And if people don't acknowledge that, just going in and saying that, the mask order has been violated, and there's consequences to that. There are fines, and if that's going to help stop this and deter this, like other things, laws, as I always said, in terms of local laws, laws are meant to deter and they're meant to stop. And if they don't, then there are consequences. That's what it's designed to do.
Okay, sounds good. And I know you were talking about schools, and your position has always been for children to be in the schools when possible, if there's not an issue with the infections in the school premises. But I've heard from a number of teachers that are seeing the infection strike the adults, as you know, but the actual teachers or staff or people that are in the school building. Yet, even if some of these students are at home, the teachers, some of the cases are still required to go to the buildings where they feel that they are exposed or putting themselves at risk. That shows in some of the infections that happen. I don't know if Phyllis can answer this question, but is there a prevalence of cases, positive cases occurring amongst teachers in the school system?
Rocco, I'm going to take that in a couple different pieces. We do have a lot of staff / teachers, staff, faculty, whatever, employees, I guess I should say, that are related to school positive cases. So when you take that concern, yes, it's a concern. However, I think the school's concern is that if you have one positive teacher or employee, et cetera, how many people have they been exposed to? So if those people are teachers and faculty as well, they have to quarantine. So consequently, from what we understand from the school districts, is that they obviously wouldn't have enough staff to be on there teaching. Will a person be exposed just because they went